Hello and welcome back, guys. I am super excited about my conversation today with my guest, Dr. Shahana Alibhai. She's a professional speaker, family physician, and mental health expert. She is best known for her TED Talk called Emotional Literacy for Better Mental Health, and she is focusing her career now on those struggling with mental health. Welcome to Inner Beauty Code, Dr. Shahana.
Thank you so much. It's such a pleasure to be here.
Thank you. So tell us more about what you do.
Yeah. So, in the intro there, it's so easy to describe myself as a speaker, as a
Mhm.
physician, as a mom of three boys. I think the more interesting story, though, the one that actually lends itself to the bigger questions, is the role that I had as a patient, right? I think
Mhm.
it's so interesting, too, as a physician, we expect our patients just to sit in front of us, be vulnerable, be courageous, tell the truth. And yet, when I found myself in the role of a patient, 9 years ago, after the birth of my first son, suffered with postpartum depression, anxiety, OCD. I did everything but tell the truth. I was completely that closed off person, pretending to the world that everything was okay. And the through line of the entire story was because I had too much shame to admit that me, someone who had spent 12 years of education studying all of this, could ever be susceptible. But that's the catch, isn't it? It's the idea that sometimes the more privilege you have, the more power you have, the more education you think you have this big bolster around you, but that bolster is filled with tiny, tiny little holes that only make you more susceptible to struggling with things like mental health. And it wasn't until discovering the power of my emotional health or emotional literacy did I finally go, why hasn't this been taught in medical school? Why hasn't this been taught in high school or even elementary school? Which I'm now happy to say I think it's definitely seeping into the curriculum. But it was like anything else, me search, trying to figure out how I could help myself, and then seeing a common issue and problem, especially amongst the patients that I see.
That's amazing. So, going back to your story specifically, how did you get the courage, or when did you start realizing that it was something that you wanted to change? Getting the courage to speak about your experience, to explore your own mental health, because I think up until, recently in the recent past, mental health and seeing a therapist or getting help for emotional problems was seen as there's something seriously wrong with you if you have to go to a therapist or be in therapy. And I think many people have a lot of shame with admitting that there's a problem and they'd rather sweep it under the rug and pretend. But eventually, like you said, it comes to the surface and then you're drowning. And
Well, you hit on such a good point there because I say this in jest, but it's very accurate from what I've seen. Especially post COVID, when you use the words anxious, I feel depressed. I think people will start to lean in, right? They'll go, okay, I'm with you on that. The minute you use words like suicidality, OCD, bipolar, schizophrenia, severe anxiety, crippling depression, it's like this force going back. It's too much. It's too crazy, right? And I say those words because that's the norm of society, and we need to start leaning in no matter what. It can't just be the mild, oh, I can have a little panic attack and then I'm talking about it. Because what's under that panic attack is usually a lot more, and it's a lot more that we don't want to talk about. So we have to get past the point of certain topics about mental health being sexy and other ones being completely off the table, right? We live in a society very much like that. It's like a push pull. I'll dip one toe in the water, but the minute you actually really open out to me, nope, too much, can't handle it, right? And that's why on the TEDx stage I called myself a hypocrite, because I absolutely was. It was this idea that I'll help you, I'll advocate for you, I'll support you, I'll walk alongside of you, but me, nope, too good for that. So for me, it really ended up, and I'll be very frank here, it was the idea that I no longer wanted to be here. I literally reached rock bottom. Sometimes we don't actually spell it out for people. It wasn't just that niggling depression or several panic attacks. No, it got to the point where I felt like my family would be better off. And what's ironic is that I deal with those types of feelings in the youth patients that I work with every day in many different forms. But yet I couldn't recognize it in myself until I started to experience those types of thoughts, and that was the wake-up call. That was going, I think it's time you actually take that ego, put it aside, take off the armor of perfection, step away from the facade that everything has to always be right. You have to look right, feel right, do all the things right, and actually make that phone call. And for me, the phone call was an anonymous physician helpline. And I remember I made the call and I told them a bit of my story, and they said, "You know, you're going to have to see a psychiatrist. You know, you're going to have to probably start medication." And my response to them was, "You know what? This conversation has been so therapeutic. I feel so much better. Thank you so much." Click, right? And that is the beginning. People always think reaching out for that first phone call, like, I'm good, right? No, that's the beginning, and even seeing a counselor, I kind of compare it to medication in some ways. You need to find the right fit. Don't say that counseling is not right for you just because the first counselor you see, you might not jive. That's not fair on you or the counselor, right? So you just have to, once again, just like with medication, there's tweaking, there's tapering. Finding that right fit also can take time, and that was the case for me too.
It's really brave too to hear you speak about it in that way, that taking the perfect facade away, because I think so many people are so worried about what other people think that they'd rather not take care of themselves than to, not live up to someone else's expectation of perfection. And in reality, everyone's really secretly struggling with something in some form. So I think it takes a person that has the courage to step forward to give other people permission to do it too, to acknowledge the difficulties.
Exactly, and I look back on my life thinking that that armor works for a little bit, and you only have an armor because it works for you, right? Like, you wouldn't have had that if it didn't. So people-pleasing, perfectionism, fear of uncertainty, fear of failure, that was like I was covered in that armor until it's like, this is not serving its purpose anymore because it's weighing me down. And also
Mhm.
inside, I felt hollow. I couldn't be the person that could have these types of candid conversations. And now, when I give a webinar or give keynotes, especially women will come up to me and say this phrase, and I've said it multiple times, no matter where I am, this is what I needed to hear right now. Right. And if I could do more of that, then I know that I'm actually leaning into this.
So, working with youth, I mean, I wanted to talk to you about postpartum depression a little bit more. So, maybe let's start there actually, because then I want to go into youth and what you kind of see are differences and how we can help youth, whether that's through our community or through our families directly. But let's start with postpartum before we go there. I know that I have friends that have struggled with this, especially when they go from having not only just one child, because you lose your identity in a way, or you have to like rediscover who you are, and deal with the hormonal issues that are disrupted when you give birth, and then just figuring out who you are now that you're completely responsible for another human being before yourself. And then, I've had friends that have had a second child, and then it becomes like so hectic trying to manage both. So, can you share a little bit more about like what signs you were starting to see aside from the thoughts that you didn't want to be here, you felt depressed, and maybe more on that subject that you are informed about?
No, of course. I think it's so important to try to differentiate the bone numbing, exhausting fatigue that goes along with motherhood. The idea that you're constantly questioning yourself because you don't really know what's going on, even though you have this tiny human that you've been given, right? That ebbs and flows, right? Sometimes days are good, sometimes days are bad. I think when you start to cross the line, you start to have, even despite maybe the baby sleeping, you're not able to sleep. Or despite the baby sleeping, you just have absolutely no get up and go, no motivation. Even more than that, it can be a crushing sense of guilt. Like, you are always questioning yourself. And then I want you to look out for the behaviors. You're avoiding spending time with your child. You want to offload the caregiving tasks on other people. You can look at other forms of, how are you eating? Are you just missing meals completely because you have zero appetite? Or are you eating constantly? Or do you have the energy to pick up the phone and call a friend? Or even if a friend comes over, do you feel like you can socialize? And by socialize, I mean let them hold the baby and go to the bathroom. Like that's probably the extensive
Yeah.
socialization that you get in that time period too. But are you
Mhm.
shutting everybody off? And
Mhm.
probably one of the hardest things is to see it in yourself because, once again, when you haven't slept properly for weeks on end, when your body has changed so much that you don't even recognize yourself in the mirror, and when you're constantly questioning, are they hungry? Are they tired? Like, what's actually happening? It can be very hard to differentiate what's normal fatigue from what is something more than that. And that's where you can rely on your partner, your family, your friends to go, look, we're actually crossing that line. Like you're not getting out anymore. You're sleeping and you're always in a dark room. You're not taking care of your hygiene. You've stopped eating, you've stopped actually socializing. All of those things tend to cross that line to this is affecting your quality of your life, right? So I think it can be tricky, but if in doubt, I think I love to say just because you mention it to a counselor, your partner, or a physician, it doesn't need to be medicated. Sometimes we get so scared to mention anything that we're like, here's a pill for that. Doesn't have to be, right? But can everybody use some support? Can everybody use some nurturing and a community and a village? Absolutely, right? And maybe that's all that you need. But equally as important to postpartum depression that tends to get more airtime is postpartum anxiety. And that is, once again, classified under mood disorders, but a very different beast. This is the type where you are constantly anxious and you don't know why. You don't want to leave the house. You're having panic attacks. You're worried about harming your baby. And adjacent to that is postpartum OCD, where you're starting to get intrusive thoughts regarding your baby. These are thoughts that you don't want to have. They can do with could you ever hurt or harm your baby? They're horrible, horrible thoughts. Many, many, many women experience them. They tend to get better over time. But you can imagine if you do have those types of thoughts, you're not telling anybody about them because you have so much shame. And sometimes those thoughts can lead to depression and anxiety too. So teasing out though in those three buckets, there's of course postpartum psychosis, which is a whole different kettle of fish, but I'm focusing on the most common ones right now too. So I think it's like a ball of yarn and trying to tease out there's factors of all of them usually.
Yeah, and it sounds like there could be like a spectrum or a combination of some of them as well. So, I mean, those are very helpful signs for women to look out for because I actually don't have children, but I've seen, all of my best friends go through some form of adjustment. And then, like you mentioned, some would rather have the nanny taking care of the child than actually deal with the first 6 months of the child's
Exactly.
existence.
The test of your relationship, right? Let's be honest. And
Mhm.
I take for granted, even in that phrase, when I say a
Mhm.
relationship, there's a lot of women out there and men who are choosing to go ahead and have a child on their own. So that brings a whole different flavor to this. So we can't just assume a stereotypical couple and baby where you have two people there. It's just a mom and a baby or just a dad and a baby. So I want to
Mhm.
be cognizant of all of that. And we have
Yeah.
to realize that those types of unique circumstances put that much more pressure on the parent.
Definitely. I wanted to switch gears now and I want to talk about youth and emotional intelligence after that. So, share a little bit about what you see and how you work with youth right now and why you became so passionate about this specific demographic.
It's so funny too because I always make the joke that growing up, when you go to the
Mhm.
mall with your parents and you might see those kids outside the mall. We all kind of know what those kids were, right? So,
Mhm.
they might be smoking, they might be drinking, they might be have tons of piercings. And it was always this thing that my mom would like, okay, we'll just kind of cross the road, right? We won't walk on the same side. Not that they were harmful or anything, but it was just that stereotype. And that once again, it's important to point out we all have these false assumptions of people based on the way they look, their color of their skin, all of that too. So when I first started working with youth, I kind of had that feeling to cross the road, right? Now I want to do anything but cross the road. These are some of the most resilient, courageous, incredible people I have ever met. Now, a lot of my career, not all of it, but a lot focuses on between the ages of 12 and 24. They don't have to necessarily be high risk, but a lot of them are high risk in their own way. They might have food insecurity, housing insecurity. They've had, I call it multiple lives in the sense that they've dealt with so many different forms of big T and little t traumas growing up as well. I think there's a lot of neglect that's happened in their life and high ACE scores or high child adversity scores as well. So then you see a patient come in front of you and they are presenting with depression or ADHD or anxiety, or sometimes they just want to talk. And sometimes they just want to let off what's on their chest and try to put some of the pieces together too. So we don't just deal with mental health. I say we deal for everything from, ingrown toenail to a headache, like everything in between. And that's what I love because you can't segregate body systems. You can't say you're anxious here, but you're having abdominal pain here and you're having back pain here. Oh, and wait a second, we don't have enough food to eat. No, everything
Mhm.
does connect and everything goes together. So that's the joy of being a family doctor. So you can see the whole person. And yes, we prescribe medication, but I always say we first prescribe living. I want to make sure that you are secure in your food, that you have a safe space to go, that you have the supports that you need. Like all of that is the much more rich prescription that I could ever give you. So I've learned a lot more from these incredible youth. And that's the premise of the book Feel Better, that's coming out in September, where I share the stories that they've shared with me and I extract the lessons that I wish I had known.
Yes, so your book is coming out September of this year, 2024, and it's endorsed by Mel Robbins. I was gonna say that before we get off, but we'll say it now. It's called Feel Better, correct?
Right. Exactly. Exactly.
So if people want to hear more about these stories, which I think is so important for everyone to look at and understand as well. And it's in listening to you hear that story, it's so amazing because I think a lot of times when people go to the doctor, the immediate response from doctors is to just prescribe you some kind of medicine to mask the symptoms that you're having or deal with the pain when honestly it's a lot deeper than that. And I think it sounds like you're going to the core, more towards the core wounds and addressing maybe the emotional side rather than just saying, oh, it's manifesting this way and physically or through your behavior that we can outwardly see. And I used to work in the foster care system a little bit, volunteering with youth, and a lot of them are dealing with things that people don't realize that isn't a common knowledge, or maybe they've never experienced adversity in their upbringing, so they can't empathize or are clueless about the struggles that some of these kids might be going through. So I think that's really helpful that you're bringing attention to that.
We all have an adolescent in our life. You probably do, whether you're uncle, aunt,
Mhm.
whether you're parent, coach, teacher, some adolescent in our life that we care for. And we know now through
Mhm.
studies that it doesn't even have to be the parent. It has to be one trusted adult that they have, right? And you probably
Mhm.
saw that in your work in the foster care system too. So one of the things that adolescents respond best to is allowing them some airtime to share what they're passionate about. Like I've learned more about space and animals and rocks and all sorts of things from these incredible youth that you think that they might not have those types of interests. So you need to give them space to share what they love, and you need to actually shine like take a big spotlight, just like a big ring light that I have here, and shine it on their progress. Because sometimes they feel like they are stuck, like they're not making any progress. And you have to really take a step back and go, wait a second, I've seen you 6 months ago. I've seen you a year ago. I've even seen you a week ago. And I want you to recognize that because, especially if you probably can attest to this, the more neglect, the more adverse childhood experiences, the less self aware one can be to actually go, I got this. Right. And I
Mhm.
think that's where we start to bolster our youth and make them have some self compassion, which is hard enough for adults, let alone adolescents.
Mhm. And sometimes people just need someone that's gonna tell them that they're doing a good job, or to give them the encouragement to pursue something that they're passionate about because maybe they don't have that in their life. So that's a really great point. As a physician, do you feel that you are advocating to educate or to help other physicians approach their patients differently from this perspective, or and in addition to actually working with the youth
Yeah.
themselves?
That's actually a very good question. I just took over as medical lead for the biggest youth health center in British Columbia, which is where we're located. And I have to say that the physicians and nurse practitioners that work well there are extremely trauma informed. They're extremely adolescent centric. So I think I've been very blessed to work with a group of people, but this is very self selected. You're not going to do this work unless you have, even for your case, right? Unless you have a passion or a gravity to work for this population too. So I think we learn a lot from each other. But at the same time, I think it's equally important that you have a sounding board with other healthcare professionals that you can bounce difficult cases off, or you can actually share stories that have really touched you or potentially triggered you in some ways as well. Because you have to recognize you're human in the midst of all of this that you are trying to absorb and understand. Because then the longevity, like my husband always says, like you're going to be good to no one unless you really do take care of yourself. So I think in that sense, the other healthcare professionals, we have a very strong team where I can go into someone's room, close the door, and then just share what I'm feeling in response to a patient's story.
Yeah, that's very important point as well that you just made, because a doctor can, like a doctor, a teacher, one person in a child's life or in anyone's life can only be responsible for so much because you spend limited time with them, and you're not their parent. So, but even, yeah, like you said, knowing to take care of yourself when you're dealing with difficulties as a service provider in whatever form is, yeah,
It's
really
easier
helpful.
said than done. It's still a work in progress for me, but something that I'm consciously needing to address a little bit more too, because with the joys of the stories also comes the heartbreak, the pain, and the trauma of the stories too. So I think it's that seesaw, that yin and yang of trying to balance those two things out, which they're never going to be in balance, but you have to somehow every time you show up fully, right? And then of course we're all humans as we are. Like I have 3 kids and it's just trying to say, okay, I need to be present right now. But that's one of the amazing things I love about the job. And whether you're a counselor, a teacher, a doctor, doesn't matter what you are. I really feel like instead of saying it's time to go to work, we should start saying it's time to serve, because that's what we need to start reframing it as. And if I can say that to myself, I go into work with a different approach.
Yeah, and it's a great perspective to come at, a nice frame to go with
Yes,
to see
exactly,
that.
exactly, right?
And I was going to say, yeah, and then it's really admirable too working with the youth, because I think a lot when I look at society as a whole and think about just experiences I've witnessed myself, and then through the different charities or volunteer work that I've done in the past, if there were more people providing services to the youth population, it prevents a lot of problems going forward. And just thinking about stories I've heard of people's lives where that one person in their life influenced or said something to them that changed their life and gave them hope or belief in themselves too to move forward. So I think it's really great for everyone to get involved if you have the time.
That's right, and it just takes one. Sometimes it doesn't, and you don't even know which phrase you might say that goes, "Okay, that actually sticks." Like, that makes the difference, and it works vice versa. Like, the whole premise of the book was built around one phrase that a youth told me, "I see myself as a person with potential." This was 8 years ago now, and I couldn't get that out of my head. His mom was in rehab, his dad was in and out of jail, he didn't know his parents at all, and he just looked at me, and that he those are the exact words he told me, and that idea just percolated, and I knew there was a book around that because I was like, how do you see yourself as a person with
Yeah.
potential? And if you do, how do we get more of us? Doesn't matter, youth, woman, man, whoever you identify as, how do we all see ourselves as a person with potential?
Yeah, that's super important and helpful. So I can't wait to read your book. But I wanted to just briefly touch on emotional intelligence as well, because I know that's something else that you speak about often. And I know that there are a lot of people out there who don't have the self awareness or emotional awareness. So maybe can you share a little bit about that so that someone listening, maybe give them some insight on how to become more emotionally intelligent or learn about this topic?
Very, yeah, no, well said. I think there's a couple of ways to approach this. The first, when you take a step back, I think mental health can be very black and white. You either have it or you don't, right? And I think even though I feel mental health should stand for meant for all health, I do believe all of us need to pay attention to it. Just the way that we live in our society, it's like, do you have a diagnosis or do you not? Do you have a pill or do you not? Emotional health is the front door to mental health, because no matter what, even the absence of emotion, numbness is still feeling something, right? So no one can deny, everyone, I always say, 1 out of 5 people in North America have a mental health diagnosis, 5 out of 5 of us have an emotion. And the audience always goes, oh, wait a second. Oh, yeah, no, that's right, right? So if we can get the conversation to bettering our mental health through the back door of emotional health, that's the premise of it all. So, for me, one of the simplest tools that I give patients and provide in my keynotes is thinking of your emotional health like a compass. It is pointing you in a direction, right? We need to think of our emotions less like stumbling blocks that are cumbersome and more like clues that are actually leading us somewhere. Because we've become, and I speak for myself, so afraid of feeling. One of the sayings that I often quote is that we don't suffer from an epidemic of anxiety. We suffer from an epidemic of not being willing to feel anything at all. That's what I see more. It's the numbness, it's the cognitive blunting. So if you think of your emotions as a compass, they tell you three things. They tell you a sensation in your body. Walk down a dark aisle and or dark alleyway and we'll all feel that, right? Your heart is racing and your palms are sweaty. They'll all tell you a story in your head, right? What is that narrator? What is that inner roommate? What is that inner dialogue telling you? That is you. That is not some external voice. It is you. I've had patients go, I'm hearing voices. And when we actually dive into it, no, it's just your voice that's there. And then the last part is why are you having that in the first place? It's a silly example, but I always go as a mom now, going to birthday parties. I go to a lot of young kids' birthday parties with my kids. And if you are not climate conscious, if you are not green, if it doesn't matter to you, and you see tons of waste at a birthday party, all the plastic and the balloons going into the garbage, that might not bother you. But if you have a climate conscience and that when you see that, that might really irk you. And I know it does to me, and I know I can do a better job of that in my own birthday parties. But you see the difference, and it all comes down to your value system. What do you value? What do you care about? So trying to look at those three S's, the sensation, the story in your head, and the compass. Where is it pointing? Why do you care in the first place? And you either have an emotion because you really care about it or because it's like a bee sting. It just stings and you don't know why. So hopefully that can set the stage for people just to start going, how do I play around with this idea of feeling something and then breaking it down into three buckets?
That was so helpful. Yeah. Thank you for sharing
Yeah,
that.
of course.
Well, aside from your new book coming out in September of 2024, where else can people learn more about you, find you? You're on YouTube, you've had TED Talk.
Yeah.
Tell us where
Yeah,
we can
of
find you.
course. Yeah. I feel like social media is still a bit of my nemesis, but I'm getting there. I'm getting there. So Instagram, LinkedIn, YouTube, my website. Send me a message on my website. I'm very active on LinkedIn, but you'll find me on Instagram. To pre-order the book, you can go to my website, drshahana.com, and I'll be available on Amazon soon. But just come and say hi, share your thoughts and ideas. And the best gift you can ever give me is that if you listen to this podcast and you had one takeaway or one pearl, we'll never know what that is until someone
Mhm.
shares it with us too. So that way I can make sure that I take that pearl and keep sharing it. So I really hope that you found something of value in this podcast.
Amazing. You guys, this will be up on YouTube and on Apple and Spotify as well. So please share any comments you have for Dr. Shahana. Thank you so much for your time and sharing your wisdom with us. I really enjoyed speaking to you, and I know a lot of people are going to listen and get a lot out of this conversation.
That means the most to me. Thank you so much for having me.
You're so welcome.